Hi, Dr. John Torres here on my daily doctor series where once or twice a week I go over headlines and give you information hopefully that you can use to help keep you healthy, keep you, your family, your friends, your loved ones, and your community as healthy as possible, mainly focusing on the pandemic that's obviously going on right now, but also other health information as well that you can use. And the main objective here is to essentially get behind the headlines and give you that information that you might get a little confused about because the headline can be a little confusing, but give you the detailed information that can hopefully help alleviate some of that confusion and again, let you walk away with some information that you can use in your daily lives to help you get through the pandemic and live as healthy as possible. And then answer questions you might have. So if you have questions, please send them our way so I can get to as many of those as possible. They're usually fantastic questions. And the first one I want to start off with is the antiviral medications that you're hearing about out there. And there's been two in the news over the last couple of days. One is by Merck, and it's called molnupiravir. And it's an antiviral medication that already got authorized in the United Kingdom. That happened yesterday. And the claim to fame to this medication, it's an antiviral pill. As of now, we don't have any pills that we can use to try and fight off the coronavirus. We have remdesivir, which is an IV type therapy. We have monoclonal antibodies that can help. But all these take either being in a clinic or a hospital where you can get either the IV therapy or some kind of or shots that can help as well. But this is the first pill that can be taken at home. Now, the idea behind this is antiviral, meaning that it actually attacks the virus. And in this case, what it does is it stops the virus from replicating, from duplicating in your body, and that helps kill the virus. Now, the best way to think about this are by other antivirals we might have. One of them, Tamiflu, which works to help try and get the flu symptoms under control and get rid of the flu virus. The other one is things like Valtrex, which can help if people have cold sores and can help with the virus that causes those. The idea behind these are that they have to be taken early on in the illness that you have, because the earlier they're taken, the less strongly the virus is taking hold in your body, and the easier it is for these pills, these antivirals, to kick it out of your body and help your immune system fight it off. Now, this one showed the molnupiravir from Merck actually showed a 50% reduction in hospitalizations and deaths in those who took it early on in their COVID diagnosis, but who also had risk factors for underlying medical conditions that put them at a higher risk of COVID complications. And again, this has been authorized in the United Kingdom. They're looking at it here in the US, and by all indications, they're going to meet at the end of the month, the advisory committee for the FDA, to go ahead and talk about this and see if they want to give it an emergency use authorization here as well. Now, remember, these help to a certain extent, but these aren't the end all. They're just another tool that we have in our tool bag to help us fight off this pandemic. And as I tell people all the time, the more tools we can have, monoclonal antibodies, these antiviral medications, and of course the big hammer, which is a vaccination, these can certainly go a long ways towards helping us not only prevent, but also treat the COVID complications and COVID symptoms and the COVID illness itself. So that's the one from Merck that's out there that's going to be seeking approval pretty soon. The other one is Pfizer came out with news, and theirs looks like it has a little better effectiveness at killing the virus. And again, it's an antiviral, same thing. It stops the virus from replicating in your body once it gets into your body. And it's also a pill that's used at home. Now, a couple of differences here. One, the Merck one is called molnupiravir, which is a typical name they use for antiviral type medications. And once it gets authorized or approved, they might come out with a more commercial type of name. But the one I like is Pfizer's name, because right now it just has a scientific name, PF 07321-332. So obviously that's not the name they're going to go out with once they try to seek this emergency use authorization. But this one is actually showing an 89% survival rate on people who take this. And again, this is for people who take it early on and have underlying health conditions that cause them to have complications or potentially higher risk of complications from COVID. So we have these two pills now, the molnupiravir from Merck and the PF 07321-332 from Pfizer, that are both going to be submitting data to the FDA. Advisory committees will meet probably again later this month for the Merck one, maybe later in December for the Pfizer one, maybe early January once they sift through all the data. and see if it really is working as well as it looks like in the data. And if it is, fantastic, because these are medications that can help us. Now, if you've ever had the flu and taken Tamiflu, you will realize a couple of things. These antivirals are not like antibiotics. If you think about it, if you've taken an antibiotic, you've had strep throat, your child's had an ear infection, you've had a urinary tract infection, anything you've taken an antibiotic for, usually what happens is within 24 hours you start feeling great. Within 48 hours you start feeling fairly back to normal. And as physicians, we always caution you, even though you're going to feel good in 3 or 4 days, this is a 10-day course. You need to take all 10 days because we want to make sure we get to all the bacteria and get them out of your body. And so the antibiotics work fairly quickly and really are good at killing the bacteria and getting them out. We're not as good with viruses, with these antiviral medications, and they slowly help. With Tamiflu, what it does is it actually cuts down the number of days you're going to be sick and reduces your chances of hospitalization or death. That's the same along the lines here. It's going to reduce your chances of hospitalization or death or serious illness, and it's not going to be like an antibiotic where a day later you feel fantastic and it kicks it out of your system. So just understand that's how these work. And they're just one more tool we have in our tool bag, along with monoclonal antibodies. Those are for the treatment of people who have developed COVID symptoms. And of course, the big one, which is the vaccinations, which are preventing you from getting COVID illnesses in the first place. And like I've mentioned many times, with the vaccination, it doesn't stop the virus from getting in your body, but it stops the virus from taking hold in your body and giving you COVID. At least that's the hope behind it, and that's why they're as effective as they are, and there's a lot of optimism behind them and why we push them so hard. So that is with these antiviral medications. Now, the other big question I've been getting a lot lately is I've been getting some questions about how are we going to know when this pandemic ends? And if you listened to me a few months ago, back in June timeframe, we were down to under 20,000 cases a day. And even I was saying, it looks like we're seeing the light at the end of the tunnel. And boom, all of a sudden we got into the fourth wave. Well, that fourth wave came about because of the Delta variant. And the Delta variant, combined with the fact that we didn't have a very high vaccination rate at the time, meant that it could take hold here in the country, more people get sick, and we went through that fourth wave. Well, we're starting to come down from the fourth wave, and if you look at the latest numbers, it's around 74,000, 72,000 patients or people a day are being diagnosed with COVID. A large majority of those, 25% of those, or a little over 24%, are children. And so that's why there's that big push to get children vaccinated. And we talked about that earlier, how now they have the emergency use authorization for 5 to 11-year-olds for the Pfizer vaccine, which is a third dosing of the vaccine for 12-year-olds and above, 12-year-olds and adults. Because they're obviously smaller, their immune systems aren't quite as mature, and they need that smaller dose to keep it safe and keep it effective. So that has already been authorized, emergency use authorized for them and recommended through the CDC. But again, those numbers, 72,000, they're coming down. We need to keep them coming down. If you look at other countries around the world, they're not doing quite as well. But if you look at them, I always put them on the baseline of per million people so we can understand what's going on, because the example I'll give you is United States, 72,000 people right now. If you look at Latvia, there's only 2,000 people. But then if you look at it per million persons, you can see that that changes quite a bit. And when it changes quite a bit, what I mean by that is the rate is very high. So here in the U.S., the rate is about 218 per 100,000 people. And so that is a fairly low rate. It's coming down. We need to get it even lower. If you compare that to Spain, Spain is 41. So we're 218 compared to their 41. But if you look at the United Kingdom, they're 574. And so much higher than we are, over twice as high as we are. If you look at Latvia, they're over 1,000. So again, this is the rate of infections they're having there, which are shown to be very high. So what that's saying is, around the world, there's still issues with the pandemic. There's still issues with these cases rising around the world. So how are we going to know when this is starting to get over with? Well, what we're looking at now are still these increases in cases. But what we're also starting to see in different areas, and not necessarily in overall areas, but in different smaller areas, is a couple of things happening. We're seeing lower cases of hospitalizations and lower cases of people dying from COVID, which is great. Those curves are flattening. And if you've followed the pandemic curves since the beginning of the pandemic, we typically get a very large curve for cases, and then a very large curve a couple weeks later for hospitalizations, and then a very large curve a couple weeks later for deaths. And that's been happening over these 4 waves we've had. Well, now what we're seeing is the curve going up for cases, but not going quite as high for hospitalizations and not going quite as high for deaths. And what's going to happen is the way we're going to know that we're getting to the point where we're starting to get more optimistic about this pandemic ending is that curve for cases is still going to go up, but the curves for hospitalizations and the curves for deaths are going to be flattened. And so we'll see that happening. When that happens, we know then that it's starting to turn the corner from being a pandemic to being an endemic virus, meaning a virus that's going to be here with us probably for the rest of our lives, but we're getting a better handle on. We're getting better treatments like these antiviral medications I'm talking about, but also better prevention methods like the vaccinations that are out there. And that's going to be the key to getting those curves of hospitalizations and deaths under control. So again, what you're going to see, you're still going to see cases. It's going to be like the cold or the flu where people still get it, but the hospitalizations won't be there, the deaths won't be as high, and so that's going to tell us that yes, we're starting to come towards the end of this, and we're starting to get to a situation that this could be the new normal going forward from here on out. And so again, that's the thing to look for. I'll keep an eye on that and let you know if that starts happening, but we're starting to see that in certain areas across the country and in certain areas across the globe, but we still have a long ways to go. The World Health Organization just approved their 8th vaccine that came out of India to try and get vaccines to more places around the world that have very low vaccination rates because of access to vaccines and access to getting to people to get the vaccines to people to be able to get them vaccinated. And as I've said many, many times, until we get the pandemic under control around the world, we're not going to get the pandemic under control here in the U.S. And so we need to keep that in mind. And as we start improving, make sure we help the world more and more to get things under control there, to get people to stay as healthy as possible so we can stay as healthy as possible here as well. And so those are the two main things with COVID. Now, the other thing I want to talk about is, well, tomorrow night, daylight savings time. Or daylight saving time, just to be correct. There's no S in that, it's daylight saving time. And what happens is we now end daylight saving time Saturday night, Sunday morning, and this is the fallback. This is when people typically look forward to because they get that extra hour of sleep. But the thing people don't often realize is even though you get that extra hour of sleep, assuming you don't cheat the system and say, well, I can stay up an extra hour late watching TV because I'm going to get that extra hour of sleep, remember that that can still disrupt your circadian rhythm, and that particularly hits you come Monday, because Sunday when you wake up you'll be a little tired, Monday even more so because you're still trying to figure out how to get to sleep, and it takes a few nights. Usually by Wednesday, Thursday, people are starting to get their body system, their circadian rhythm organized and their circadian rhythm in sync with the new clocks that we have starting once we start falling back because of daylight saving time. So the thing to remember is you're going to be tired. You're probably going to be making some choices that you normally wouldn't make, as in food choices, eating more junk food. So the more healthy food you can have on Monday, if you go to work, take healthy food with you. That way you can snack on that instead of snacking on the unhealthy food, but also realize you're going to be a little tired. Now, here's the thing. So even though we fall back that hour, even though that we might cheat a little bit and stay up an extra hour late, we're still probably going to wake up the same biological time, not necessarily the same clock time Sunday morning, same thing on Monday morning, possibly Tuesday morning, because our bodies are used to waking up at a certain time. So typically if your body's used to waking up at 7 o'clock a Sunday morning and we bring that clock back, well, now you can be waking up at 6 o'clock Sunday morning. And so realize you're going to lose that extra hour, and that's going to impact you as time goes on. So just remember that's going to happen over the weekend. But the other thing to remember is this is the one where we end up falling back, we end up gaining that extra hour. And this is one people typically like versus the springtime one where we end up losing that hour and everybody, that's the worst one. But also realize that not as much with this one as the spring one, but it does implicate people's health. There are more traffic accidents, more people have heart attacks because of the circadian rhythm switches here. So just be careful with each other, be careful with yourself, and keep an eye on each other and keep an eye on yourself as well. So now let me see if you have any questions.
Why is it taking so long for the FDA to give full approval for the Moderna vaccine?
So why is it taking so long for the FDA to get full approval for the Moderna vaccine? And that's a great question. And once they get full approval, then that's a permanent approval. So the FDA is very diligent about making sure they have the data. And if you remember, when they got the emergency use authorization, they wanted 2 months of follow-up data after people got their second shot to get that emergency use authorization, because we were in the midst of the pandemic, many thousands of cases, people hospitalized, people dying from COVID. We needed a vaccine that could really help out. So they were able to do it in 2 months to look at it very well, make sure it's safe and effective. But now, because it's going to be approval means a permanent approval, they want more information, more data. And so what they're saying is we want 6 months worth of data. We want to make sure that we look at the manufacturing process, actually do a quality assurance on the manufacturing process. And that's just taking a little bit longer with Moderna and Johnson & Johnson as well. And so those are going to follow here. Moderna is looking at it right now. They're submitting their data. Hopefully the FDA gets the data fairly soon here. But the other thing is, they have these vaccines out there. We're still in the midst of the pandemic, and so they want to make sure they do it right. They don't go faster than they need to on this one, just to make sure that they dot all the I's, cross all the T's, look at everything they've looked at, look at all the data, look at the manufacturing process. Now, this doesn't mean they did not look at it initially, but when they initially looked at it, it was a much smaller data set. They want to follow it further out this time, so it's going to take a longer process. Pfizer was able to jumpstart that process early on and get that information very quickly. Moderna's not as quick at this point, and so it's been slowed down a little bit, and then Johnson & Johnson to follow as well. And don't forget, there's a fourth vaccine out there, Novavax, that is also looking to see, okay, when I get my emergency use authorization, what the FDA is looking at now is, do we want to give it an emergency use authorization? Do we really need to get it at this point? Or do we have enough vaccines that we can wait until we give it full approval? In other words, wait for all that more complete data to come in to give it its full approval, and that's what they're looking at right now.
Is it okay to get the flu shot with the booster vaccine on the same day? Some of my friends have been experiencing some side effects.
So the question is it okay to get the flu shot the same day you get the COVID shot? Yes. The nice thing about the COVID shot is that you can get the COVID shot with the flu shot. You can get the flu shot the day before, the day after. It doesn't matter. Timing doesn't matter with this. And the reason a lot of people are asking this question is because for a while there, for many, many years, decades, we would tell patients, if you get a vaccine, wait 2 weeks to get the next vaccine. That way your immune system can rev up, it can quiet down again, and then it can be ready for the second vaccine, so it's not trying to fight off a couple things at the same time. And then we found out that only applies to essentially live vaccines that are out there, live virus vaccines. And neither one of these are live virus vaccines. As a matter of fact, we have very few of those. And so since they're not live virus vaccines, it doesn't matter what sequence you get them in or how close together you get them. The only caveat is if you're getting both shots on the same day, I'd get them in separate arms or separate. They'll make sure they do separate spots if you want them in the same arm, only because there are going to be those side effects. Injection site soreness is probably the biggest one people experience. And I know when I got my booster shot last week that my injection site soreness lasted probably 2 or 3 days, and so it's a real thing and it happens. But I'm through that now. I'm fully vaccinated and I've gotten my booster, and so you might feel a little more of the side effects if you get doubling up on the shots with COVID and the flu, but not a whole lot more.
Are masks really that important as more people are becoming vaccinated?
So masks are important as more people become vaccinated for a very good reason, and that's because we know, first and foremost, realize that masks' main job are to protect other people from you. They do help protect us a little bit from other people, but the main job is to protect other people from you. Ideal situation, both people have masks on that are interacting with each other and they're protecting each other from each other. That's the ideal situation. Well, part of the confusion with all the communication that went on around masks came this last summer when they said, okay, vaccinated people no longer have to wear masks. If you're unvaccinated, you still do. And so a lot of people started taking off their masks, including unvaccinated people taking off their masks. Well, that caused a couple of issues, and something came along that caused an even bigger issue, is cases started going up because more people, unvaccinated people, were taking their masks off as well. But also the Delta variant came along, and we realized that the Delta variant was sneaking around the vaccines to a certain extent, to the point where it could be spread to other people. And so then we found out that people that were fully vaccinated, in very small cases, very limited number of cases, could spread it as well. And you can't really tell who's going to be spreading it, who's not. So let's get everybody masked and try and get this back under control. And so that's where we are right now. So if you're vaccinated hanging out with other vaccinated people in an area with low cases of rates or low rates of cases, then you might not need to wear a mask, especially if you're in a ventilated indoor area where it's not that big of an issue. But if it's an area that has high case numbers, if there's intermixing with unvaccinated people, if you can't social distance, then those are situations where you still want to wear a mask, even if you're fully vaccinated, just to protect yourself, protect other people. and that way other people will wear masks as well, hopefully, and we'll get this under control. So again, thank you very much. These have been fantastic questions. We went over a couple things. The antivirals, Merck is coming out with one. That one shows 50% effectiveness at preventing deaths and hospitalizations if taken early, and people who have pre-existing conditions that put them at higher risk for COVID complications. Pfizer came out with one showing 89% effectiveness at preventing those hospitalizations and deaths. The Merck one is already authorized in the UK, probably be looked at here at the end of the month by the FDA Advisory Committee, maybe authorized middle of December timeframe. The Pfizer one is following suit. We'll probably get all the data to the FDA by mid-December, maybe the end of the year, beginning of next year. On top of that, we talked about how the pandemic is going to end, and that's the flattening of the hospitalization and the death curves. The case curves might still be going up, but as long as we get those hospitalizations and deaths under control, then it turns into this endemic virus that we end up just living with, controlling through vaccines, the main thing. And then we talked about daylight saving time, which occurs this Saturday night. Even though you pull that clock back, you get an extra hour's sleep. Realize that's going to disrupt your circadian rhythm, and that could cause some problems, especially come Monday. You might be a little more drowsy than usual, so be careful when you're driving. Be careful with the choices you make, particularly food choices. Take healthy snacks with you to work. That way, when you go down there and you start snacking on food, you're snacking on carrot sticks or celery sticks and not things that might not be as healthy for you. So, again, thank you very much. Hope you have a fantastic weekend. And as always, I hope you stay healthy, hope you stay happy, and hopefully we get through this pandemic as soon as possible. Thank you.